Kia ora koutou, no waitakere, ko Jeff Adams aho, kia ora, tātou katoa. So greetings, hello to you all. I'm Jeff Adams from New Zealand. As I start, I'd just like to acknowledge we're meeting today on ancestral lands and recognise my role here as a visitor today. What I'm doing today is presenting a view from New Zealand, and I'm just hopeful that some of it might speak to the experience of this almost largely Canadian audience. When I put together this research program that I'm working on, one of the things that strikes me as fundamentally important is that everybody talks about developing health for everybody, and my sort of argument is that a lot of people are missed out on these discussions. For example, in the New Zealand Health Strategy, we have this grand statement that all New Zealanders will live well, stay well, get well, and that good sexual health is important. But we know that health promoters don't deal well with the issues of queer men, or queer people, sorry. So today I'm focusing on Asian populations in New Zealand, and this is one group that is also missed out a lot in the health discussions. So New Zealand has a very kind of weird view of what Asia is. China in the north, Indonesia in the south, Afghanistan in the west, and Japan in the east. Sorry, my geography's failing. So that is what when we talk about Asia, that's what we're talking about. In New Zealand, there's around 590,000 Asian people, so not a huge population. We're a small country. The key features really have been a rapid increase in recent years, despite there being Indian and Chinese populations in New Zealand for a long period. And the growth in the Filipino population is rapid and relatively new. So here's Auckland. Most of my research, or the research I'm talking about today, is based here. Similar to Vancouver, the water is very present. So Auckland is one of the most diverse cities in the world. The last ranking list I saw had it the third most diverse country. Auckland within New Zealand is the largest city. It's also the most diverse city, and you can see there it has fewer New Zealand European, it has more Asian, more overseas born, and it's a younger population than the rest of the country. It's also an area that has a disproportionate number of gay and bisexual men. So not surprisingly, the key, I guess, underpinnings of this argument, to putting it simply, really, is that ethnic minority status and sexual minority status, and I know those two words have loaded meanings, which is why they're kind of in those hyphens, has the potential to lead to health inequity. In relation to Asian gay and bisexual men, one of the key features has been a doubling of HIV diagnosis over a 5-year period. So you can see there's been a steady and constant and I guess troubling increase in the HIV diagnoses. And the trend is still continuing, although it looks like it might be kind of turning around a bit, which is in line with the general trend as well. So when we were doing our studies, one of the things that really struck us is that health promoters, including those within in the HIV field, have very little knowledge or understanding of Asian men. And one of the things that we did was undertake some really broad-based studies to really introduce to health promoters some of the key ideas that they should be considering when developing programs. It's, for example, it's notable that the New Zealand AIDS Foundation, which is the leading health promotion agency, did have an Asian health promoter for a couple of years, and then that position was reassigned. So even within the lead agency, there's been a kind of a focus away, or an explicit focus away from considering Asian populations. So we've undertaken 3 studies, and I'm just going to kind of briefly talk about some of the key ideas that are arising from these in a minute. But they've worked with different populations. We've worked with Chinese and South Asian populations. South Asian essentially can be read as Indian in the New Zealand context. We've done a research project around Filipino men, and those projects were both very similar, looking at issues around how people live their lives and how that impacts on the way that they engage with HIV, health promotion and services. And then our most recent study has looked at PrEP and views about PrEP amongst Asian men. I'd just like to acknowledge that this work has been done by a team, and there's some members of the research team down there. And where possible, in all these projects, we've also employed Asian men from these communities to work on the project in various roles, for example, interviewing, doing transcriptions, developing recruitment. So a lot of community support to help us get these projects done. So really the most important thing that I think that we want health promoters to take on board is the diversity of this population. And I think this is really important because health promotion is good at lumping everybody together and delivering or targeting or doing things the same. And I think it's really important that we have health promoters understand that there's difference in relation to ethnicity and culture, religion, language. There's also differences in the immigration pathways that people have taken to get to New Zealand. And all those factors are very important for health promotion to take on board. I think that these differences really do speak to the need for ensuring that ethnic-specific research is undertaken where possible. So looking at particular groups, so looking at Filipino rather than looking at Asian, because once you start to put all that categories together, which is the usual practice, the differences and the nuances disappear, and we start to treat everybody the same, and everybody's not the same, as we all know. So just some of the key ideas that we are wanting to communicate to health promoters are these, and I'm just going to quickly run through them because I know we don't have a whole lot of time. Understandings of sexuality. So when we undertook this study, we were told you can't use the terms gay and bisexual, they don't mean anything to anybody. And yeah, we were quite happy to take that on board. The results were everybody that we spoke to engaged to some degree with these concepts. So I think that was quite a useful learning for health promotion to say, look, people can deal with these constructs and work with them. The really important thing, I think, was the way that men managed their sexuality or disclosure of their sexuality. So while there was a strong degree of personal acceptance, there was varying degrees the way that people discuss their sexuality. So very few people were out to their families. And that again varied by ethnicity. So Chinese and Filipino were much more open. The Indian men were much more controlled about the way that they dealt with their sexuality and the way that they presented in other situations. So when when participants talked about family support, it was really important, I think, to note that a lot of people did not have good family support around their sexuality. So you can see in this quote, for example, the mother is reported as being tolerant rather than accepting. When we when we were looking at these issues of ways that people accounted for sexuality, we found that explanations of non-Western kinds of ways of thinking about sexuality were very rare. And for example, in this quote, a participant talks about a collective kind of perspective of sexuality, which is not something that a lot of us kind of consider, but he thought that by his coming out to his parents, what he was doing was essentially putting himself first. It was a selfish act because he was thinking of himself, not of his family. So again, that's one way that a different way of sexuality was put forward. Conservatism was a really big idea in the literature. So this person here is talking about how they might look modern on the outside, but inside they're still quite traditional and conservative to a certain extent. One of the kind of related issues that we came up with in the research was that there was a lot of emphasis put on norms of, I guess, what we ended up calling sort of a romantic discourse, and wanting to talk about sex being something that's a relationship-focused thing and not kind of just a physical act. So really playing up the important thing. And alongside of that went a notion that was put forward quite often that that Asian men were not as sexual as other men. And that is, I think, a really important thing for health promoters to take on board when they're developing up interventions. So it was really pleasing in our research that most men felt they fitted in well to the Auckland community, and with minimal reports of kind of discrimination and issues like that. What was difficult, and I'm sure it's no surprise to most people in this room, was really the discrimination and racism that was experienced within the gay community. And so, as lots of studies have reported, apps like Grindr and whatever are really problematic sites for a lot of people. And here you can see in this quote, the person talks about it experiencing lots of kind of negative comments and then just coming to the sort of realisation, well, I just have to get used to it. Connections with others is really, often with other gay and bisexual men is often sort of put forward as a really strong preventative factor for HIV and for providing support to other men. What we really found was that very few people had strong connections with gay and bisexual community. And the one exception to that was the Filipino participants who had developed up really strong support networks amongst others. And so here you can see this person's got a group of friends, some transgender, transsexual, gays and bisexuals, but no lesbian, and they do lots of things together. But that was kind of a very exceptional kind of circumstance. So we have a kind of community that is not connected well with each other, either physically or online. When we looked at more specific issues around HIV knowledge and engagement, it was really pleasing that people had good basic understandings of HIV and things. What was less kind of positive in a way was PrEP knowledge. People have very poor PrEP knowledge, and the latest studies just looked at that. People don't know how it works, they don't know how to access it, they don't know if they're eligible for it. So there's a lot of stuff that needs to be done to raise awareness around things like PrEP. There's very poor engagement with HIV testing. The only, and condom use and PrEP. So just to finish up, there's kind of a lot of things that can be done to improve the situation. And I think, so actually I'll just leave that slide up there. You can read it while I'm going to sit down, but thank you very much.